Since 1933, Whittier Street Health Center has provided high-quality, reliable, and accessible healthcare to Roxbury residents. Now, with a new state-of-the-art patient-centered medical home, Whittier is increasing capacity, efficiency, and effectiveness to meet the needs of a broad and diverse population, and expanding its focus to ensure access to equitable, high-quality, cost-effective care. Many of the communities that Whittier serves face significant disparities in healthcare access and outcomes. Roxbury, Whittier's primary service area, has the highest rate of low birth weight and infant mortality, and greatest number of emergency room visits and hospitalizations due to diabetes and heart disease.
At Whittier Street Health Center, our focus on health care equity is important to improve the quality of care while lowering costs through actionable strategies to make sustainable improvements in the lives of our patients. To ensure high patient satisfaction and to reduce the racial and ethnic disparities in healthcare and health status, we have developed a team-based, patient-centered model of care. This model also incorporates patient self-management education to educate and empower patients to engage in healthy lifestyles and behavior modification.
Whittier provides the same high-quality care to all patients, regardless of their ability to pay for services.
I first came to Whittier Street about 20 years ago as a HealthNet patient. What I found was that I got the same level of care, same level of respect that I had received from my previous healthcare providers, but with a level of warmth and personal touch that I hadn't seen before. I fell in love with this place and I just never left.
In order to address the significant racial and ethnic health disparities of its service community, as well as the social and environmental determinants of health, Whittier has successfully implemented an innovative and comprehensive model of care.
We like to think that we were a medical home long before that term was fashionable. We have rooms that have been specially designed for group medical visits, which we've been doing a lot with diabetics and pregnant women and people with cardiovascular disease, where we can have a multidisciplinary team of physicians and nutritionists and clinical pharmacists, diabetes educators.
By focusing on both wellness and support, the Health Center team works together in a holistic approach to care for the whole person and to ensure that all patients are full partners in their own health and well-being.
I feel accepted as an equal partner in the business of maintaining my own health. And as a partner, I'm encouraged to take greater responsibility in that role. And that's a good thing for any patient.
By partnering with other organizations, such as Dana-Farber Cancer Institute, Whittier is able to identify and target the specific needs of the community. Whittier's new building includes a community-based cancer center to address the cancer disparities.
When you look at cancer care and how cancer care is delivered anywhere, high-quality cancer care, it's not really given in the communities where patients actually reside. And this gives us a unique opportunity to combine the trust of the community here at Whittier Street with the expertise at Dana-Farber. And I think it's separate from anything that anybody's doing in the country.
As a normal part of my physical exam, my annual physical exam, I usually take a PSA test. When my PSA test results came back, the results were a little bit over 4. I had the prostate biopsy, and the prostate biopsy came back as positive for cancer. Because of the early detection, I feel that I no longer have to worry about dealing with cancer in its final stages.
In addition to medical and social services, Whittier also offers educational programs to meet the needs of patients in all age spectrums. These education programs incorporate patient self-management education to educate and empower patients to engage in healthy lifestyles and behavior modification.
Part of my role is working with people of all ages, including pediatrics and adult patients, helping them to make better choices with the foods that they're making, One of the most exciting things is actually showing them how to prepare some of the meals in a healthier way.
Whittier has a special partnership with my school to teach the students about healthy lifestyles and healthy living. For example, what we have learned from the nutritionist about portion control, we applied to our math of proportions. And we have discussed substance abuse and use in science. For me, I'm able to discuss my family history of diabetes and high blood pressure. Also, as a young African American male, I know what I have to do to keep a healthy lifestyle.
Dedicated to serving the community, health ambassadors, community health workers, and social health coordinators function as part of the care team, helping patients to address the barriers that impact their health. This allows Whittier to simultaneously reduce the burden on primary care clinicians.
I'm a cardiovascular health ambassador. It's an important role because the community needs information. The community needs Whittier Street to continue to do the fabulous and outstanding work and outreaching to the community.
No other health center does more outreach than we do.
We serve the community by bringing health education to the senior centers, schools, churches, and public housing. Whittier is unique in the sense that we focus on the patient's greatest needs, the ones often overlooked by the healthcare system.
Whittier also hosts workshops and educational presentations, which give people the tools to take action in their own lives.
We have created a culture of wellness and support in our community, and our team approach to providing patient-centered and community-centered care makes preventing health problems and improving the quality of life a priority. This individualized, high-quality, cost-effective care has resulted in significant improvements in the health outcomes of patients at risk for costly and debilitating chronic diseases. And with this expanded capacity, have the opportunity to save, enrich, and empower many more lives in the years to come.
By investing in Whittier Street Health Center, we are investing in a healthier future, one that ultimately yields significant savings for all.